Hi people, teacher and classmate. Welcome to a new video. My name is Claudio Omar Alvarado Ramos and I will talk about of non-alcoholic fatty liver disease, insulin resistance and ceramides. My social networks are Facebook, Claudio Alvarado, Twitter, I Claudio Alvarado, and YouTube, Claudio Omar Alvarado. Well, introduction is a term that covers many clinical pathological conditions. It has an overall prevalence of approximately 20% to 30% in adults and up to 75% in OS patients. It is more frequent in women, and most patients are diagnosed between 40 and 50 years.
It's a serious disease caused by a growing epidemic.
Fatty liver disease is a condition that's more common in those children who are overweight or obese, and it's essentially an accumulation of fat in the liver.
Pediatric gastroenterologist Dr. Archie Ramaswamy says fatty liver disease is being diagnosed in children as young as 6 years old.
There are associated conditions such as diabetes, insulin resistance, hypercholesterol.
Children with fatty liver disease typically have no symptoms, so the disease is found through blood work. If severe and left untreated, it can lead to liver failure.
The liver is an organ that also is more sensitive to this fat accumulation also. And it's not based just on a certain body mass index or a certain weight. There are a lot of factors that go into it also.
Other factors like genetic conditions can also lead to fatty liver disease in children.
What I like to do is a full workup to look for other genetic causes of liver inflammation, the elevation of liver enzymes, just to make sure that we're not missing everything. Certainly having a family history of high cholesterol, diabetes, things like that also does make a child more prone to having those conditions, but also to having fatty liver disease.
Limiting sugar and processed foods and encouraging a healthy diet and regular physical activity can prevent and treat fatty liver disease. For Lee Health, I'm Lindsay Morton.
Okay. Second, applications in medicine. Insulin resistance, IR, is present in most, but not all, obese and elderly patients, and even some young teen people. It is a precursor and accelerator of coexisting conditions such as type 2 diabetes, arteriosclerosis, non-alcoholic fatty liver disease, and probably cancers associated with obesity.
Non-alcoholic fatty liver disease is actually a spectrum of disease, going from least to most severe, steatosis, steatohepatitis, fibrosis, and finally cirrhosis. Watch the full video on osmosis.org.
Okay. Third, pros and cons. Pros, ceramides such as diacylglycerols are bioactive intermediate lipids, and cons, various types of lipids are involved, and molecular mechanisms that affect the action of insulin are debated.
Non-alcoholic fatty liver disease is more common if you are overweight, have diabetes, or have high levels of fats in the blood, like cholesterol or triglycerides. Non-alcoholic fatty liver disease can also run in families. Patients who have family members with fatty liver disease are at higher risk. Some people can develop non-alcoholic fatty liver disease even if they do not have any risk factors.
Okay. Fourth, I should apply in Ecuador. A sample for convenience was obtained from 285 students of the Catholic University Santiago of Guayaquil. An anthropometric survey was conducted, blood samples were taken, and abdominal ultrasound was performed to determine the levels of non-alcoholic fatty liver. The results are prevalence of non-alcoholic fatty liver was 37%, anthropometric body mass index values. Height and waist perimeters were significantly increased in students with non-alcoholic fatty liver compared to those who did not have this ultrasound diagnosis.
And your Fox Family and Health, it is a disease that impacts nearly 100 million people across the country, non-alcoholic fatty liver disease. It is more prevalent, though, in South Texas than almost anywhere else in the United States. And now there could be a cure in our own backyard. 1 out of 10 people with diabetes can have chronic liver disease, liver cirrhosis, or even liver cancer. This can result in a heart attack, stroke, or even death. But now the Diabetes Institute thinks they may have an answer to this ongoing problem.
There is this new molecule that have shown to have a lot of promise in extracting all that fat out of the liver and actually pretty much potentially curing your fatty liver and eliminating all those risks.
Right now, Dr. Solis says the best way to help yourself is to follow a proper diet and exercise.
Okay. In conclusion, dyslipidemia to be most important risk factor for fatty liver presentation. The insulin resistance index has a high association with non-alcoholic liver fat disease, and we propose its use for early detection of fatty liver infections with one or more MS factors. Thank you very much for your attention. Goodbye.